to be presenting this morning on engaging champions to influence change and sustain practice. We welcome Maureen here today. And Maureen Loft is the nurse practitioner, clinical nurse specialist at the Strathroy General Hospital, where she provides care to both medical and surgical inpatients and outpatients. Maureen is also the BPSO lead for the Middlesex Hospital, chairs the Falls Prevention BPG, and provides wound care consults following the recent completion of the Wound Care Champion program. A Wounds Canada and RNAO developed program. Prior to joining the team at Strathroy, Maureen worked at St. Joe's Hospital Care, London, for 28 years, where she began her career at the bedside as an ICU nurse. A dedicated lifelong learner, she returned to the University of Toronto and completed her acute care NP program in 2002 and worked as the NP CNS in orthopedics and diabetes. She completed her PhD in nursing at Western University in 2015 with the support of the RNAO as a PhD fellow. Her research looked at the patient's experience of initiating insulin therapy and the impact of utilizing the RNAO best practice guidelines. Maureen's life beyond nursing includes an amazing husband and 3 adult children. She loves roller coasters. The faster and more upside down, the better, she says. She also enjoys wine and dining with friends, and she enjoys that preferably after the roller coaster rides. Maureen, we welcome you today, and we thank you so much for everything you've done throughout your professional practice and the impact that you are having on others. And we are really looking forward to hearing about what you're going to share with us today. Thank you.
Thanks very much, Julianne. I'm very honored to be here. I love working with the RNAO. Love the support that we've gotten throughout the years, and honored to share the work that we've done here at the Middlesex Hospital Alliance with our best practice guidelines and our best practice spotlight organization designate. And thank you to all that are here. I know it's a very busy time of year. If your organization is anything like ours, we're currently in surge capacity, so clinically it's very busy as well. So if you can take a few minutes to spend some time with us today, that's great. And if you have to pop away, that's okay too. I totally understand. I do want to build upon the land acknowledgement. This is very significant for me. I've been honored to be bestowed an allyship, and it's part of the work that I always do as well. So just building upon what RNAO has already done. I want to recognize that the land is an expression of gratitude and appreciation to those whose territory we reside on, and a way of honoring the Indigenous people who have been living and working on the land from time immemorial. The land acknowledgements for me is not just ticking a box. It's really about trying to encourage others to take action and support our Indigenous communities. I think if you're just ticking the box, then you need to do some more self-reflection and maybe some more education. On behalf of the MHA, this is our statement where we recognize and acknowledge that our 2 hospital sites are on Indigenous land that has been inhabited by Indigenous peoples for thousands of years. There are long-standing relationships within the 3 local First Nation groups of these lands in Middlesex County. We wish to recognize the 3 First Nations communities with long-standing ties to this area: the Chippewa of the Thames, the Anishinaabe, the Oneida Nation of the Thames, the Haudenosaunee, and the Munsee Delaware Nation, the Lenni Lenape, and wish to show respect to these communities today. So just to give you some perspective, and my apologies to Northern Ontario, I realize that Southwestern Ontario isn't the only area in Ontario, but just for the map convenience, our 2 hospitals are located approximately 30 minutes west of London, Ontario. So those 2 X's that you see in the center of the slide there, the X closest to Toronto would be the Strathroy Middlesex General Hospital site. And then about 20 to 30 minutes southwest of here is our 4 Counties Health Services site. So just to give you an idea of where we're situated in the province. As I said, we're two small community hospitals. The SMGH site has 54 funded beds. Currently, we're in surge, so we're over that at this point in time. And same with our four counties health services, 12 beds, 12 acute care beds. At the SMGH site, we have approximately 160 nursing staff. Again, these are numbers that just sort of give you an idea about the size of our organization and our resources. The nursing staff here, we have one NP, but then a mixture of RN and RPN staff as well. So we started our best practice work actually back in 2015 before we even applied to become a BPSO designate. So just to give you some context about where our journey started from. At that time, these are the first 5 or the first BPGs that we implemented after we did our pre-designate time and then became a designate. And then at that time, we added person and family-centered care and the alternative approaches to restraint. So we've been working with the BPGs for a long time, say even before we became a BPSO. So I like to say that we are small but mighty. We like to do things and provide the best care that we can. We have to acknowledge, though, that we need to leverage our resources efficiently and effectively. And that, sometimes that's a challenge with our health human resources, especially nowadays, post-pandemic. Fortunately, though, again, being small and mighty, we've been able to commit to keeping our champions quota. So we have about 19% of our staff are champion educated, and we're able to maintain that. So that's really good for us. As I said, a small organization, so we have a lot of one-ups. There's like one nurse practitioner, 1 or 2 social workers, 1 or 2 pharmacists. So we, we're a small group, so we strongly depend on our interprofessional colleagues to help us maintain our champion network and support and sustain the organization. So just a nod back to 2015, as I said, when we were actually using the falls prevention BPG prior to becoming a BPSO. If you look at the center of the slide there, you'll note that we introduced the falls BPG in 2015. And so the darker mauve color there shows that we had a really good implementation, and we're able to significantly decrease our falls, so, 142 to a couple of years later down to 98. Now, obviously, as an organization, we're never going to eliminate falls because we also want to mobilize our patients. And so there's a strong focus on that. But again, the BPG was really good at helping us get our falls rate down. If you're paying attention closely, you'll notice that our sister hospital had a slight increase in the falls reports. But the reason for that is because we didn't have an accurate reporting system at that time. So implementing the BPG was helpful for us to be able to more accurately assess. So all in all, you have to report good with the bad. So we had both improvements once we had our BPG implemented. I like to highlight this best practice guideline. So the assessment and management of pain and preventing pressure injuries are those 2 BPGs that our organization work together. And they're led by, this group is particularly led by one of our pharmacists. So interestingly enough, when we spoke with the staff and we did our gap analysis, the first project that they did was actually non-pharmacologic. The results were that we weren't able to position our patients comfortably because we didn't have enough pillows. Right, so very simple intervention. We just didn't have enough of them, and with one pillow to try and position somebody comfortably on their side, just not adequate. So through this BPG, we bought 100 pillows and we spread them throughout the hospital, and nurses were very happy to be able to position their patients more comfortably and not have to use as much pain medication. So again, a non-pharmacologic intervention. This one, if you were able to attend the best practice symposium recently here in London, we were able to highlight our work with this cognition wall. So this was work through our falls prevention, our 3Ds group, the delirium, depression, dementia, and our alternative to restraints. So basically what we're looking was to look at providing some cognitive stimulation for our patients who are on our medicine floor. A lot of those patients tend to be elderly, or perhaps they're ALC waiting for long-term care. So we know the importance of keeping them cognitively stimulated. It also helps for our younger patients who are just bored. So this has 4 panels to it. There's what we call the garden panel, Tinker Tailor panel, driving panel, and kitchen panel. So each of these panels, a lot of work went into designing them, making them very intentional about the activities that they would provide to patients, patients and families. The one thing I'd like to highlight at the end of the slide, which you can't really see very well, there is a mailbox on the garden panel. And what this did was allow us to engage with the community. So we asked the local schools to send us birthday cards, get well cards, holiday cards, so that if we happen to pull one out, and we'll say to a patient, "Oh, look, you received a card." So it's engaging with our community, providing some support for our patients. So as I say, the Cogwell was probably one of our biggest accomplishments through our BPG program, our BPSO. I have a closer slide here for you to just demonstrate the fact that the patients are able to sit at the wall with either family member, volunteer, not often staff members because they're doing their clinical care, but they can watch the monitors. We have a lot of older patients either from Portugal or the Netherlands here, so we let them drive through the fields of tulips in Holland, or they can drive through the countryside in Portugal. So that's been a really important feature for us. So as I say, lots of champion work had already been done, and then was like, well, how do we maintain this? How do we keep the champions engaged in the work that we're doing? Again, especially at the times where we're surging and we don't have, the nursing staff is probably getting exhausted. So again, lots of intercollaboration between our staff, and we decided that we would do off-site workshops to get them away from the organization. To be quite honest, and the practicality of it was when we were on site, people got called away, staff got called away to do, provide nursing care. So very thankful to the leadership at the organization here for Middlesex Hospital Alliance, who supported this with funded time. People could attend, paid time, and the offsite, so they could really focus on the things that we were trying to do. So some educational updates, and also really trying to build our skills for our champions to make sure that they realize that they are leaders in whatever way that they can enact that. And I'm going to go into that a little bit more. So those were the workshops. Our objectives were to recognize our champions, give them some, time away to be able to build up their educational opportunities. At this particular one that we did in the spring of June this year, we looked at health literacy and personality types and how they work with the collaboration of the team model, and augmented our senior friendly lens, because here we wanted to make sure that we're culturally appropriate, looking at our equity and our diversity, and making it culturally safe for our patients. So we started with a fun thing, the Marshmallow Tower Challenge. Not sure if people are aware of this. So it looks like it's a really fun thing to do, but there's always method behind our madness. There's always rationale for what we do. If you're not familiar, there's lots of things on YouTube. There's a great TED Talk about this Marshmallow Challenge, which is used across all disciplines, business, healthcare, education. And what it does is it pulls a group together. They have 18 minutes to build the tallest tower that they can with spaghetti, string, and masking tape, and then they have to put their marshmallow on top. So when you break them out into groups, people have to learn how to work really well together, really quickly, build the tower. There's lots of competition between the groups. But again, what we're looking at is, how quickly can you pull your skills together to be able to work as a team? So we start out with fun, but as I say, there's a method to our madness. And then we moved into the health literacy piece. So the next 3 slides are posters that are readily available for you through our Southwest management program here, which used to be part of, which is now currently part of Ontario Health at Home. So I would encourage you, if you do like the next slides that I go through, the access information are on the slides. And so again, we were looking at those of us who've been in healthcare for a long time, often fall into the medical lingo, the healthcare lingo, and we really need to be focused on what is it that our patients are hearing. We do have a large immigration population here as well. So, when we say we need to draw some blood today, do they understand what that means? Does that make any sense to them at all? So these are very simple posters that we use to help, again, increase awareness about health literacy. Also numeracy as well, like medical number management. As a nurse, you need your dressing changed. Well, maybe somebody who's never been in the healthcare system doesn't understand what the dressing is and thinks that I'm about to give them a salad. So again, just helping to expand the knowledge base of our champions to promote, health literacy for those patients that we're caring for. Elevate your feet above your heart. What do your patients think? Do they understand what we mean by getting your legs above your heart? That kind of stuff. So again, really good posters. They also offer a workshop on health literacy. So I would strongly encourage people to access those. They're completely accessible and free of charge. So a great way to start if you're going to look at your health literacy piece. Then we moved into sort of building our champions skills and strategies for teamwork collaboration. So a lot of you are probably also aware of this personality, the true colors assessment skills. It's available free online as well. So again, this starts out as fun, right? You have a questionnaire where there are 20 groups of words, and you're asked to look at the groups of words and not think about it too hard. Just look at the words and which one represents you the best. So you rank them as to what's more similar to you. And so at the end of it, you get your color analysis. And so again, it's not just one type of color. So we're all a combination of colors, but typically what will happen is somebody's colors will there'll be a couple of that are dominant, right? So, and so then we started to, so drill down a little bit. Well, what does that mean for you as a worker when you're working in a team? So for example, I'm a blue-orange. A lot of healthcare providers are blue, this compassionate piece of it. But when I did this, it was a great knowledge gain for me in that. So as an orange, which probably drove Julianne a little bit crazy as well. So as an orange, I get things done in time, right? If the deadline is this date, so I get it done by that date. However, those are my green colleagues and my gold colleagues, they're going to have it done 3 weeks ahead of time. Every detail is going to be there. It's all going to be finished. It's all going to be ready. So as an orange, I have to remember that I'm going to drive my green and gold colleagues crazy. So maybe I should get it done a little, that facilitation piece of it. So this is the thing that we explored with our champions. Let them explore, what does their personality type, their behavior styles, how does that impact the work that they're going to do within the groups that they're working? So again, a fun activity, people really enjoy it. What color are you? What color, what do you know? And sometimes, they read through the attributes and like, well, that's not me. But again, it's a generalized thing. It's a tool to help you understand how you're going to work as a champion. If you're going to be the leader and help us spread our BPG work, our BPSO work, how will that be influenced by you? So that's a fun activity to do. And then we moved into our senior friendly lens. Again, we have a large geriatric population here, or older person population here, is a patient population. So looking at making sure that the care that we're providing people have an appreciation for what it is that their patients might be going through. So we have a great kit that includes several different items. This one, the slide you have here is demonstrating about visual impairment. So there are glasses that show what it's like to have cataract, what it's like to have macular degeneration, partial blindness, diminished vision. So we have the champions wear the glasses, try to read a piece of paper, try to look out the window. What difference does it make? Does it make sense now that the person's a little bit confused because they can't see? There's some gloves, special gloves that decrease your manual dexterity. So that's to help sort of, how is it to try and pick out your pill out of your pill bottle? Can you do that? Can you open your blister pack with when your manual dexterity is down? And the other one that I wasn't able to do for this webinar, just because it didn't translate well, is an audio where the message is left. It's Middlesex Hospital calling, your appointment at CT is this day at this time. Please arrive here, bring this, so when you listen to that and realize, as I'm talking very quickly, and I do apologize for that, how does that message come across to our older patient or older client? So all of these things, again, just to bring to the forefront and let our champions know that, things to consider when we're trying to provide the best care that we can for each patient. So I have a short video here. Again, I like to make things that are down to earth, fun, use humor to do it. If anybody is aware, I'm sure most of you have heard of Brene Brown. So a social worker, originally was her undergrad, amazing researcher. She has an amazing TED Talk called The Power of Vulnerability. So I would strongly encourage you, if you've never seen that TED Talk, to go through it. And this is her talking with Jimmy Fallon about leadership. And again, there's some really distinct, important messages in here about being a leader and what it takes to be a leader. So let me hope and cross the fingers I can get it started.
Building your online business?
Apologies, I'll just skip the commercial.
Go to Wix.com and set up your store.
Our next guest is a New York Times best-selling author and research professor who has a brand new weekly podcast on Spotify called Dare to Lead. Here is Brené Brown. Yeah, Brené, it's so nice to see you. Thank you so much for coming back to the show. I appreciate this. I want to talk about this new podcast. It's about leadership called Dare to Lead. I don't know. I just feel like it's a good message for anyone, because one of your messages in your book that I read earlier is that every one of us is a leader in some way. It's not just for people in charge. Like, everyone is. Can you expand on that?
Yeah, I mean, I think when we think leader, we think like pinstripes and shoulder pads and the C-suite office. And the truth is, I've been in those offices and couldn't find a leader to save my life. And I've been around everyday people that would never identify as a leader and been surrounded by them. So I define a leader as any person who holds themselves accountable for finding the potential in people and processes and has the courage, the guts to develop that potential. And that's all of us. I mean, I recently asked John Meacham, I said, what would you say to people who don't think they're leaders? And he said, then you don't understand democracy. We all have to lead. Wow. And so I loved that. I think we're all leaders.
You've interviewed all of these people and trying to find, and you've studied leaders, and you try to find patterns. What are a few patterns that you always see showing up in good leaders?
Yeah, this was the shock for me. In fact, this is my 23rd year as a researcher, and this is a 10-year study. And it was the first study I'd ever done where the answers across all of the research participants was the same. So what we asked was really straightforward, from special forces military to creatives to all over the world, NGOs. We asked, what's the future of leadership? Who's going to be leading in 5 years, 10 years, and who's going to be gone? And the answer was, we need braver leaders. And so when we drilled into what does that mean? I mean, I love the word brave, I love the word courage, but they're gauzy. Like, what does that mean? Yeah. It came down to 4 skill sets. The ability to rumble with vulnerability. That means when things get uncertain and hard, we don't tap out. We don't tap out of hard conversations. We don't tap out of feedback, giving it or receiving it. Mm-hmm. Second thing is that we really learn how to live into our values. I mean, the most daring leaders we've talked to are very clear, not only about what their values are, but also what the behaviors are that support those values. Like, there are a lot of big, fun leadership words like integrity, but like if I walk into another organization and see an integrity like poster with an eagle, like what is that? It's like, what does that mean?
I don't know what it means. You were on Sky Mall and you were bored and you go, it's only $10.
Sky Mall. No, Sky Mall. And you don't know what it means. So these leaders have operationalized it into behaviors that they hold themselves accountable for. The third thing is building trust, talking explicitly about trust, because no trust, no teams, no good work. And the last one is huge. And I learned this from working with a lot of professional sports teams. You've got to know how to reset after failure, disappointment, and setbacks. You got to learn how to get back up when you fall, because that's part of being brave.
All right. So again, I love Brené Brown. You can tell that. Well worth a view. That original TED Talk is like 67 million views on YouTube. So well worth it. And again, this I think resonates with our staff and our champions. It brings it down to a more personal level to understand that it's important for them to be a leader as well. So when we looked at the evaluations from the workshop, most participants we covered well. We did our objectives. It enhanced their learning. For leadership here, we're happy to see that 100% of the participants felt that they could apply it to their work at the MHA, and then thought it was a good workshop. So we were good that way. Well, we gave them some homework though. So we wanted to carry through to try and sustain the work that they'd done. They spent the 4 hours at the workshop. So their homework was they got this sheet and they were to pick a best practice guideline. Pick one small thing that they want to do, not implement the entire guideline, just pick one small thing from that guideline that they thought they might be able to do to help enhance the care in whatever area they are. And again, our champions are across the organization, not just in the nursing unit. So, take it home. They had the summer to do it. We were going to follow up with what we call champions chat. So just another 2 hour, again, kudos to our organization for recognizing the investment in our employees and in the champions. So paid time to come back, tell us how their champions work, whatever their homework was done. And then again, when we're off site, provide a little bit more education, update education about staff that they could use. So I just want to highlight our laboratory success. So the lab went away. They chose the Person and Family Centered Care BPG. And what they realized through the work that we've done with the health literacy, senior-friendly lens, is that they wanted to develop patient resources that would help the patients understand why they're coming in an ungodly hour, usually, to take their blood and those kind of things. So they developed a resource sheet that is included in our, what we call our patient information package. That's part of our Person and Family Centered Care when patients are admitted. So they developed this resource. So why were you getting your blood? What does this mean? And then, so they developed the resource, and then they use it as part of their accreditations. The laboratory has separate accreditation as opposed to complete hospital. So they were able to sort of incorporate this all into their accreditation standards. So from one small workshop, one little bit of homework, the lab was able to take and run with it and have a really significant impact on how they provided their care and integrating the BPGs. So that was really important for us. So what are our lessons learned? What are my takeaways for you? As I say, one of the best resources, and I was just reviewing again last night, the Leading Change Toolkit is amazing. Completely accessible, open access, the tools that are there, the knowledge to action framework, the social movement action framework. There's 33 tools that you can use with the knowledge to action framework. And it's very easy to find the stuff that you're looking for. Like it's well developed. So there are so many resources there for you to use. You could do the whole day on the leading to action, which I think maybe you guys do. But at any rate, if you need anything, it's there. Clearly an important tool to use. Be strategic about your timelines. So again, in an acute care facility, you have to really recognize, time away from the bedside, time away from patients. But again, it's that balance between investing in our champions and making sure that they feel supported and able to continue the work that we do. I'm going to be honest, currently, again, in a surge capacity, we really struggle sometimes with getting our direct care providers there, but at least we're always listening and they always know that they can access us and feed their ideas through or their concerns through, their gaps through, and then we'll work with them to try and get the gaps addressed. And we talk about the fact that, again, small but mighty, but that one small workshop made to a big change for our lab people. So that was great. So this quote, never doubt that a small group of thoughtful, committed citizens or champions can change the world. Indeed, it's the only thing that ever has. So I thank you for your time today. Hopefully this has been helpful, and happy to entertain any questions, or my access is there if you need to email me.
Wow, that's amazing. Thank you so much, Maureen. The work that you and you're doing with your team, the champions, is absolutely incredible. I really am in awe of the power that you're providing your patients with all the activities, and just for them to feel so empowered. And that's incredible through your work and how priority. So thank you for sharing all your work that you and your team are doing there at Middlesex Hospital. I would like to open up to any questions. If anybody has any questions for Maureen, if you just want to put those in the chat. Maureen, a lot of comments about the video. They really enjoyed the video. It's too very empowering, and reminds us all that we are leaders. And so wonderful that your team is leading such amazing things happening through implementation of best practice guidelines and what you're doing. I really, really love all the activities. I don't live too far from Strathroy. I might have to come down and see that wall in person. That's pretty cool.
Yes, come and see.
Okay, we do have a couple of questions here before we finish today. The first is, how do you ensure that champions who aren't nurses feel equally as interested in the program? That's a great question. So, the program's open to everybody, right? All healthcare. So what about those who aren't nurses?
Yeah, so it is a bit of a challenge because as soon as I start saying RNAO and they say, well, what does that stand for? Registered Nurses Association. So then they're like, well, then I can't be part of it. So I always preface whenever we start doing any of this work that it's not just about nurses. You know, nurses are absolutely an integral part of the work, especially on our acute care clinical units. But again, I think we've been able to demonstrate that if you're clear about the fact that you don't have to be a nurse, you know, and that we need participation in a small organization like this, where we all wear multiple hats. You have to be able to work and collaborate with everybody. So again, majority of our allied health are all involved in the best practice guideline work, and we wouldn't be able to do it without it. Many of the leads of our BPG groups, like I say, pharmacist leads one, social worker and speech language pathologists lead the other one. So a lot of them are not led by nurses; they're led by our allied health.
Wow, and that really does show through the activities and such that you've created there, that the involvement must have been, you know, all across the board. I'm really to ensure that you're ticking off all those boxes, and that really shines through. The second question is, do you include the BPSO program in new employee orientation? That's a great question. We often through the webinars see that question because those who are coming through orientation, there's a lot of information for them. But what about the BPSO? Is that something you do include in your orientation?
Yeah, so that was something that originally we did not, and through attending webinars and the champion webinars and other RNAO programs, realized that that was the gap. So we did. So we have so there's corporate orientation. So for corporate orientation, the fact that we are a BPSO, what that means, the fact that you don't have to be a nurse to be part of that. So that's presented at corporate orientation. Then nursing has a separate day. So at that separate day, an additional day. Then we begin to lay the foundation for champions, what that looks like, recognizing that new employees are often going to be overwhelmed by, you know, a new organization. So I don't want to just sort of make them say you have to become a champion, but just again, highlighting the work that we've done and just what we lay out for them is that as you start to acclimate to our organization, if you see things that you think you could help with or that you can improve, then either speak to a champion and at whatever point you feel comfortable, because you know obviously it's going to take some time for them to feel comfortable in their new organization. And when you feel comfortable, the opportunity is always there for you to become a champion. So and that does happen for us.
That's wonderful. That's wonderful. I'm so looking forward to hopefully you joining us back in 2025 with other projects that you have going on. It's really exciting to see the work that you're doing and just the engagement of your champions and what you're doing there for your staff and your clients is really uh, it's amazing. Really great to see. You're a small but mighty organization in Strathroy, and I've heard so many good things about Strathroy General Hospital. So that's wonderful. It was a pleasure today, Maureen, to hear all the work you're doing. We thank you for that. Reminder to those who are joining us, a copy of today's presentation and webinar recording will be posted on the RNAO website. And we are going to have a survey there sent. Please fill that out. And any questions, please reach out to Andrea Stubbs. And just a reminder that this work is funded by the Government of Ontario. And for more information about the RNAO's Best Practice Champions program, please visit our website. I just want to double check the chat, Maureen, before we finish off today. There is, oh, so I have a question here. I'll just read it. There is more, this is more of a question for RNAO. I find a challenging part was encouraging staff to become a champion on their own time or do yet another e-module. Is there a way for us to teach them the how to be a champion in person? That is a great question. In 2025, we are going to have some other opportunities on the Champions workshop and webinar. And so stay tuned for that. At this point, though, we have an incredible blended learning Champions workshop that is self-directed on part 1, part 2. There's several dates to join us for. Part 3 is also self-directed, and then part 4, some other dates to join us for, as well as the e-learning module that is all completely self-directed through all 4 parts. But we are looking and have heard you, and we are looking to possibly bring more opportunities in 2025. So please stay tuned for that. And thank you for that comment. It is so important, as Maureen has said, and Maureen has shown us the work that champions can do. So anything that we can do to grow our champions is very important for both, RNAO as well as all the BPSO sites. So thank you for your time today. Maureen, thank you. I hope to see you again. Very exciting what you're doing, and congratulations to you and your team on all your achievements.
Thanks so much. Really, really proud to be part of this organization and part of this RNAO team as well.
Thank you. Everybody have a great day, and we'll see you again in the new year.